Hey guys, 6 days since my surgery and I'm feeling awesome. Every day's a little better, get a little more feeling back in my face. It's still really numb on the outside, but on the inside I'm slowly starting to get back that feeling in my lip. I imagine that's going to take some time to completely come back, but it used to be numb all the way over here, and now we're to about here. So still have this whole section in here that's got no feeling. Like I said, I feel awesome. No pain medication. I am taking ibuprofen, not for the pain, but to help with the inflammation, to get the swelling down a little bit. But other than that, I mean, you know, like I said, this process for me has been really easy. I haven't used any ice packs today. It's the first day I haven't. I went out and bought a heating pad. This weekend, my doctor approved me to start using heat on my face. He said that'll help the swelling significantly, but he doesn't want me to use it just quite yet. A couple more days before he wants me using heat on my face. So we're getting closer. I did get to see the x-rays. I think I counted 20 screws and 4 plates in my lower jaw, so I didn't think there was going to be that many. I'm sure there's a reason for why there were so many, but it did kind of surprise me to see that many for what I thought was a relatively minor operation. But doctor was very pleased with the way everything lined up. As you can see, no rubber bands, and I'm really pleased with how wide I can open my mouth already. You know, 6 days after surgery, and I can. That's pretty good. So, if I could give some advice as to what's helped me get to that point as quickly as I have, I would say the first thing is I didn't just sit around the house. I tried to get up, move around, walk around, get the blood flowing. You know, the surgery is an invasive surgery. It's a big surgery, but it doesn't mean you can't get up and move a little bit to help yourself feel better. So, if you could do anything that would really help you heal quicker, in my opinion, get up, move, and use the ice packs 24/7 for the first 5 or 6 days, and I think that's going to significantly help the swelling, because in my opinion, the swelling's the worst part. The other thing is, I didn't take the pain medication, and the reason I didn't is because the pain medication they prescribe makes you really, really lethargic, and I don't like that feeling. I don't even like taking ibuprofen or Tylenol, to be honest with you. So, for me, as little unnatural stuff in my body as possible is going to be the best way to go. So, those are two things, in my opinion, that have really helped me heal quickly. You know, I've been really fortunate. I haven't seen anybody on day 6 with as much mobility. I get to start eating pasta this weekend as well. So about a week into surgery, and I can, you know, already start eating pastas and things like that. Other than that, I mean, I don't really have a whole lot to say. You know, things are going great. I'm excited about my new bite. My last video, we talked about how my bite didn't look parallel as it came down, and if you look at my bite, you'll see kind of what I'm talking about there. It's called an asymmetric bite, and it's not the surgery that caused that. I actually had that before I got the surgery. I looked at a video before, and I'd always had it. I just never noticed it. So that's actually fixed with the orthodontics. They just got to move. I believe it's this side of my lower teeth got to go up. And he said that's no problem. It's not the surgery that caused that. They basically cut my jaw in half right here, and they moved the lower parts out, and then they put a plate down here, which I can kind of feel, and then one up here. So that's how they I guess they must have taken a strip out, because they did narrow it, but they also changed they tilted it a little bit. And I can definitely feel a change. All my back teeth used to touch, and now only one spot touches. But that was to, he said, you know, in order to get that asymmetric bite fixed, that's what they had to do. So very pleased with everything. Appreciate all the comments, the thoughts and stuff that you guys have sent me, and wishing me good luck means a lot. And as far as I'm concerned, the rest of the healing process is cake. The first week's annoying because you can't really eat anything. You're swollen, a lot of pressure. But for me, it wasn't pain, and I went into it with a positive attitude. And so if you guys are getting the surgery, stay positive, and don't sweat it. Don't worry about it. Don't stay up at night, and don't let this get to you. If you're on the fence about doing it, every video you've seen about post-op, everybody always says do it. And I wouldn't say anything different. I'm much happier with the way my teeth line up now. And definitely was a great decision for me to make. I wish everybody the best. I'll post a couple more videos probably once a week from now on. I don't really see any need in my case to keep posting videos, because even though I'm still swollen and definitely don't have a lot of feeling in here, the worst is definitely over, and I'm on the way up, and I'm feeling great. So thank you guys. Good luck to everybody out there, and I will post another video here in a week or so.